Assalamu alaikum dear viewers. Today our topic of presentation is penicillin. So penicillin is basically the first class of antibiotic which is most important and most economical. So penicillin are obtained from fungus Penicillium notatum or Penicillium chrysogenum. It is basically obtained from a fungus. Now coming towards the principles of antibiotics. So antibiotic act on four principles. Either it may be bactericidal or bacteriostatic or synergistic action or antagonistic action. So bactericidal means it can kill the bacteria, and for example aminoglycosides. And bacteriostatic means it can suppress the growth of bacteria, stop the growth of bacteria, for example macrolides. Synergistic action means when we give two drugs combinedly, so its effect will be enhanced by the one drug enhance the effect of other drug. For example, penicillin plus aminoglycosides. Antagonistic action means when we give two drugs, its effect will be one drug will decrease the effect of another one. For example, penicillin plus tetracycline. Now coming towards the mechanism of action of antibiotics. So it may be divided into four types. The first one is inhibition of cell wall synthesis, and the classes of antibiotics include penicillin, cephalosporin, carbapenem, monobactam, and vancomycin. The second was inhibition of protein synthesis, which include macrolides, chloramphenicals, aminoglycosides, and tetracyclines. The third one is inhibition of nucleic acid synthesis, which is fluoroquinolones and rifampicin. The fourth one is inhibition of folic acid synthesis, which is sulfonamides. So coming towards penicillin. So penicillin are cell wall cross-linked polymer of polysaccharides or pentapeptides. Interacts with penicillin binding protein, cytoplasmic membrane binding protein. It inhibit this transpeptidation, and there will be no cross-linking and there will be no formation of cell wall. Now coming toward a spectrum means its range of activity. So narrow spectrum mean which active against gram-positive bacteria, which is example is penicillin G, penicillin V, and it is mainly active against meningococci, streptococci, and pneumococci. Very narrow spectrum example is methicillin, oxacillin. It means it is just active against staphylococcus. Broad spectrum mean which is active against gram positive plus gram negative also, which is ampicillin and amoxicillin. And extended spectrum means which is also active against Pseudomonas aeruginosa. Now coming towards its properties, so it is optically active and it is effective in the treatment of respiratory tract infection. Now coming towards its mechanism of action. So its mechanism of action is cell wall synthesis inhibitor. It inhibits the last step of cell wall synthesis, which is transpeptidation reaction, and it inhibits the cross-linking of cell wall. So thus inhibit the cell wall synthesis, and its action is bactericidal, which means it can kill the bacteria, it can completely destroy the bacteria. So its action is on the cell wall. Okay, now coming towards its classification. So it is basically classified into the following groups. The first one is natural penicillin, which is penicillin G and penicillin V. The other one is beta-lactamase resistant penicillin, which is methicillin. Aminopenicillin, the third one, ampicillin, which example is ampicillin, amoxicillin. The other one is carboxypenicillins. Carboxypenicillin, example ticarcillin, and the fifth one is uridopenicillin, example are piperacillin. The sixth one is penicillins and its inhibitor combination, which is ampicillin plus sulbactam or ticarcillin plus clavulanic acids. So this is the combination with penicillinase inhibitors. So thank you for watching.